Okay.
Let's go to visual diagnosis. Inspection. The topic is purple tongue. When blood stagnates, the tongue will become purple in color. This reflects poor circulation, which in Western medicine will be a sign that the blood is not being optimally oxygenated. There may be a reddish purple or bluish purple color. If the tongue is reddish purple, then it is heat that has stagnated blood, resulting in blood becoming thick and sticky. Blood stagnation can in itself also generate heat. Cold can also stagnate blood by causing the vessels to contract, making it more difficult for blood to circulate through them. At the same time, cold will block the yang qi that propels blood through the vessels. The tongue will be bluish purple in color when the stagnation is due to cold. The tongue can also have a slight mauve tinge, which the eye must be trained to perceive. This indicates liver qi stagnation, resulting in blood not circulating optimally. There may also be purple spots in specific areas of the tongue. This will indicate that there is blood stagnation in the relevant area of the body. The sides of the tongue can be purple when there is liver blood stagnation. A purple tongue always indicates stasis of blood. There are two types of purple color, reddish purple and bluish purple. In this picture, we see a reddish purple tongue and it indicates heat and stasis of blood, and it develops from a red tongue. And in this picture, a bluish purple tongue that indicates cold and stasis of blood, and it develops from a pale tongue. A purple color is frequently seen on the sides, indicating liver blood stasis, or in the center, indicating stasis of blood in the stomach. A purple color on the sides may also reflect blood stasis in women, and in such cases, it is usually bluish purple. Internal cold contracts and obstructs the circulation of blood, leading to blood stasis. Heat leads to blood stasis by condensing the body fluids and blood. When blood stasis derives from cold, the tongue is bluish purple, while when it derives from heat, it is reddish purple. Therefore, the bluish purple tongue indicating cold derives from a pale tongue, whereas the reddish purple tongue derives from a red tongue. Here in this diagram, we can see the development of the tongue color from cold being pale tongue. When the cold obstructs the movement of blood, it becomes bluish purple, which indicates blood stasis. And when there is heat, the tongue is red. And when the heat condenses the blood, it becomes reddish purple and also an indication of blood stasis. A tongue becomes purple only after a prolonged time, usually years. Therefore, it always indicates a chronic condition, and for this reason, it is far more common in the elderly. The purple color of the tongue indicates potentially serious conditions, and in the presence of such tongue body color, we should always invigorate blood and eliminate stasis, in addition to expelling internal cold in the case of blood stasis, deriving from cold and clearing heat in the case of blood stasis deriving from heat, even in the absence of any symptom of blood stasis. Serious conditions relating to blood stasis in Chinese medicine include cancer, coronary heart disease, stroke, and hypertension. The tongue can be only partially purple, and the most common areas are the sides, the liver or chest area of the tongue, and the center and the front third. The most frequent occurrence is on the sides in the liver area. Strangely, the tongue is never purple on the tip only, and blood stasis in the heart usually manifests in the chest or breast area instead. A purple color on the sides in the liver area indicates blood stasis in the liver, which may occur in any of the areas influenced by the liver channel. For example, liver blood stasis in the hypochondrium, epigastrium, lower abdomen, and uterus. As you can see in this picture, the purple color in the liver areas. Although the uterus is in the lower burner, whose state is reflected in the back third of the tongue, blood stasis in the uterus is manifested with a purple color, not on the root of the tongue, but on the sides in the liver area. A purple color on the sides in the chest area indicates blood stasis in the chest, which may include heart or lungs in a biomedical sense, or in women only, the breasts. In lung diseases, a purple color in the chest area is seen in chronic obstructive pulmonary disease, such as chronic asthma, bronchitis, or emphysema. In heart diseases, a purple color in the chest area is seen in coronary heart disease. In addition, in women, a purple color in the chest or breast area may indicate a breast pathology, such as breast lumps, whether benign or malignant. Observation of the breast area in women suffering from carcinoma of the breasts is an important prognostic factor because if this area is clearly purple, the prognosis is poor, whereas if it is not, the prognosis is good. A purple color in the breast area is also sometimes seen in women without any breast pathology. This may indicate the predisposition to breast lumps, and one should therefore invigorate blood and eliminate stasis in the breasts, even in the absence of symptoms and signs. You can see the purple color here in the breast and chest area. A purple color in the center of the tongue indicates blood stasis in the stomach, whereas a purple color in the front third indicates blood stasis in the lungs. Here's a treatment note that to treat blood stasis in the breast or breast with acupuncture, one should use GB21, GB41, and stomach 18. In women, we should observe carefully the breast area, also called the chest area. In the absence of lung or heart disease, in a biomedical sense, the breast area reflects pathology of the breast in women. In particular, a purple color of the breast area indicates blood stasis in the breast. This can potentially lead to carcinoma of the breast. However, the emphasis is on the word potentially. We should never assume that a woman has breast cancer purely on the basis of a purple color in the breast area. Nevertheless, if a woman has a purple color in the breast area, we should actively invigorate blood in the breast. For purple tongue, as a summary, it always indicates blood stasis. When it's reddish purple, there's blood stasis from heat. Bluish purple indicates blood stasis from cold. Reddish purple sides is liver blood stasis. Bluish purple sides in a woman is blood stasis in the uterus. And purple in the center is blood stasis in the stomach. So we can see here in this chart the indications of a purple tongue. The indications for blood deficiency, internal cold, or blood stagnation, the tongue body will be blue or purple or pale purple. And the tongue coating for blood deficiency and internal cold is moist and white, and for blood stagnation, it can be dry. The indications for extreme heat, phlegm damp, yin exhaustion, and alcohol toxin, the tongue body will be dark red purple. And the tongue coating for extreme heat will be dry and yellow. For phlegm damp, it's glossy or greasy. For yin exhaustion, there's usually no coating. For alcohol toxin, it will be dry. And the pathogenesis for all of these indications is invasion of exopathogenic heat, cold or damp, or internal pathogenic changes can both lead to the stagnation of qi and blood, which accumulates or overfills the vessels, giving rise to the purple color. So the purple areas on the tongue of the liver areas is liver blood stasis or blood stasis in the uterus. The breast and chest areas is blood stasis in the heart or breast, and the center is the blood stasis in the stomach. Thank you so much for your attention.